Hello and welcome to this webinar today on ethealthworld.com. Today's topic of discussion is breast healthcare in India. Is this the time for a paradigm shift? To present this webinar, today we have with us Dr. P. Raghuram, President of the Association of Breast Surgeons of India. Dr. Raghuram is among the foremost breast surgeons from South Asia. He was conferred the prestigious Padma Shri by the Honorable President of India for the year 2015, making him one of the youngest doctors in the country to have received this award. Without further ado, I welcome you, Dr. Raghuram, to present this webinar.
Good afternoon. At the outset, I bring greetings from Krishna Institute of Medical Sciences, which is the largest corporate hospital in Telangana and Andhra Pradesh. Whilst preparing for this talk, like I do for other talks, I always remind myself that you don't speak because you want to say something. You speak because you've got something to say. The aims of my presentation today are essentially threefold. Firstly, to touch upon the turning point in my life that brought me back to India. Secondly, to highlight the delivery of breast healthcare in this country. And finally, to outline some of the paradigm changes that have been introduced in an endeavor to improve breast healthcare in our country. What you see here on the right-hand side is the national premiere of the largest theatrical production of film ever made in the world. It was in the year 2010 that this cancer awareness film was made by a Indian-born Bollywood producer by the name of Namrata Singh Gujral. And the national premiere, which normally is done always in Bombay, which is the Bollywood capital, for a change, it was done in Hyderabad. And the people who you see here on your right are all breast cancer survivors and their families. I just want to take you through a glimpse of this film.
The global burden of cancer will double by 2020 and triple by 2030.
1 in 8 American women get diagnosed with breast cancer.
Cancer is the leading cause of death worldwide.
Worldwide, over 1 million women are diagnosed with breast cancer every year.
Regardless of color, regardless of nationality, regardless of religion.
The cancer journey is universal, especially if you're a woman.
It was as if a stealth bomber had come in the middle of the night. You feel totally healthy, and they give you this kind of news that stops your world. I had a very difficult time believing that I really had breast cancer.
And that feeling of total dread where your legs feel like lead.
I always used to say, God, don't make me suffer.
So there was a lot of anger with God.
Why is this happening to me?
I think it behooves all of us who can to speak up and say, I have had such an experience.
You must face the reality.
It is the plague of our times.
Hello, you better wake up. This is about your health and your survival.
Particularly, when we're young in our 20s and 30s, we go about life thinking that nothing can touch us.
Men get breast cancer too.
This is a global problem.
Cancer is not one disease. It's hundreds of different diseases and hundreds of different causes.
Let's pool all of our knowledge and all of our revenue and all of our skills.
There are women that are now living without any evidence of disease and without any therapy for 10, 15, 20 years. If they're going to succumb from something, it will likely not be their breast cancer.
I am really going to take advantage of how important every moment is.
Chances of surviving have increased dramatically just in the last 10 to 15 years.
The overwhelming majority of women with breast cancer will survive.
Once you fear it, and then you are it, and you go through it, you realize how flimsy fear is. I'm a breast cancer survivor.
I am a cervical cancer survivor. I'm a multiple myeloma survivor.
My mom is a breast cancer survivor.
There is light at the end of the tunnel.
Here I am, I'm 17 years later.
It's our obligation to educate women, to enlighten them about breast cancer. Every 3 minutes, a woman is diagnosed with breast cancer in America. Every 13 minutes, a woman dies of breast cancer. Worldwide, a woman dies
Of breast cancer. 1 a minute.
More people die of cancer than all the deaths of AIDS, malaria, and TB combined.
So this is the film that Usha Lakshmi Breast Cancer Foundation premiered in this country in 2010. Like for everyone, there are turning points in everyone's life. And nothing, ladies and gentlemen, nothing prepared me until my mother was diagnosed with breast cancer.
I have been to UK along with my husband on a holiday trip to visit my son and daughter-in-law and grandchildren. Suddenly I found that there was something abnormal in my right breast, which I conveyed to my son Raghu, and they have taken a biopsy which proved to be cancer.
Whilst inquiring about my mother's treatment in India, certain startling characteristics, certain startling basically features dawned upon me. First and foremost, I realized that breast surgery was not a subspecialty in this country. There are very few dedicated breast specialists. The concept of breast centers was non-existent. There is very little importance about early detection of breast cancer, and counseling, which should so much become an important component of cancer care, is not even a part of medical curriculum in this country. A woman finds a breast lump, she reports to her doctor. She'd be referred for a mammogram, which does not necessarily happen on the same day. Even if it happens on the same day, the patient is asked to return for the report. But the most alarming thing is that there is a huge variation in breast imaging reporting in this country. Almost 6 out of 10 breast imaging reports that I see at the center in KIMS Usha Lakshmi Center for Breast Diseases are wrong reports. Anyway, finally, the surgeon comes in for assessment. Triple assessment, which should be a standard of care for any breast lump, is not a common practice in our country. FNAC is very common, and core biopsy is still not the standard of care in our country. Frozen section is very common, women not knowing whether she would wake up with or without the breast. The typical scenario, yes, it looks like a cancer, come in on Monday, we'll do a frozen section and decide. So, having practiced the art and science of breast surgery in the United Kingdom, having had a settled status, it was a difficult decision for me to decide as to what to do. Either continue to be part of an established system in the United Kingdom or return to India to make a difference. And I decided to come back with the concurrence of my family, my wife and children. We moved back in 2007. I had a dream, and I was reminded of what Swami Vivekananda said. Take up one idea, make that one idea your life, think of it, dream of it, live on it. Let the brain, muscles, nerves, and every part of your body be full of that idea, and leave every other idea alone. This is the way to success. And I developed a strategy to improve in my own sphere of activity, breast health care in my motherland. And I set out on a mission. And I wanted to introduce a few changes alongside like-minded colleagues in this country, an association that I have developed over many years, well before returning to India. Firstly, to establish a dedicated center for breast health to standardize breast health care, not necessarily only cancer care, but breast health care. Secondly, to establish a breast cancer foundation to create awareness about importance of early detection of breast cancer. Thirdly, to implement a population-based breast cancer screening program to ensure early detection of breast cancer. And finally, somewhere along my professional lifetime, alongside like-minded colleagues, to attempt at developing breast surgery as a distinct subspecialty in our country. I knew there were challenges ahead, and I also knew that dreams are a dime a dozen. It is their execution that counts. Before I dwell into some of the specifics that were introduced in terms of paradigm changes, just to outline that breast cancer is a cancer tsunami in our country with 150,000 new cases being seen. It's only the tip of the iceberg because many cancers are not reported to the cancer registry. As you can see here, in 2008, breast cancer was the second most common cancer affecting women. Cervical cancer was the commonest cancer affecting women, followed by breast cancer. But if you see the latest statistics, breast cancer has now overtaken cervical cancer to become the commonest cancer affecting women in this country. It comprises of 1/3 of cancers affecting women, as you can see from this graph. Now, this is a worrying slide. The column in blue represents what it was 25 years ago. The column in red represents what it is now. Once upon a time, 25 years ago, breast cancers were more common after the age of 50 years, whereas currently breast cancers are more common under the age of 50, and the peak incidence occurring between the ages of 40 and 50. This is the consolidated, basically, the population-based registry based out of Thiruvananthapuram, which shows that nearly 50% of breast cancers occurring under the age of 50. This is from Chennai, 48%, and this is from Mumbai, more than 50% of breast cancers presenting under the age of 50. This is from hospital-based cancer registries between the period of 2007 to 2011. And needless to say, because of lack of awareness and because of an absence of an organized breast cancer screening program in our country, the vast majority of cancers present in the advanced stage. As I said earlier, lifestyle changes like late marriages, not having children, having the first child after the age of 30, not breastfeeding, prolonged use of hormone replacement therapy, lifestyle changes, some of these cannot be changed, in fact, lack of awareness, absence of an organized national breast cancer screening program, cancer not being a priority issue for the government, enormous resource constraints are ensuring that clinical advances do not reach the vast majority, and more than 50% of breast cancers in our country present in the advanced stage. Majority are grade 3 tumors. Average size of tumor presentation is about 5 centimeters, 60%. And up to 25% of cancers present with triple negative cancers. These are young women with high-grade tumors. Mortality, which is a key measure of cancer burden in any given country, it has touched 70,000 deaths per annum in our country. If you see these statistics particularly outlined in the red box, United States, China, India, and European Union. Although you can see that in the United States in the year 2008, the incidence of breast cancers were 182,000 cases per annum, the number of deaths were only 40,000. Whereas if you see India, at that same time, 115,000 new cases were reported and 53,000 died of breast cancer. If you see 2012, although the incidence of breast cancer in America has increased to 233,000 per annum, the number of deaths remained almost the same at 44,000 deaths per annum. Whereas in India, the incidence has gone up significantly to well over 150,000 now, and the breast cancer mortality, the number of women dying of breast cancer, has also significantly increased to 70,000 deaths per annum. So you can see the comparison of what it is in the United States and what it is in India. To summarize, although the incidence in states is going up, the mortality remains constant, almost similar. Whereas in India, the incidence of breast cancer is going up and so is mortality. Only 1% of our GDP is spent on healthcare. In fact, there was a 20% drop in the healthcare budget allocated for 2014-2015. And just over 1% of our patients are covered by private insurance. And clinical advances certainly are not reaching the vast majority of people. Having given this background, the first paradigm change that I wanted to implement was to establish a dedicated center for breast health, because there is evidence from published literature and well-established models in Europe and in America that improved outcomes for breast cancer and indeed for breast health can be achieved if specialists with a declared interest and training manage patients in dedicated comprehensive breast units. So this was the world's first dedicated breast center, the Van Nuys Breast Center. It was freestanding, it was purpose-built, it was comprehensive, and it was the first unit in California. And having worked in the UK, having seen how a dedicated breast unit functions at the world's oldest cancer hospital, the Royal Marsden Hospital, and the Nottingham Breast Institute, where I had done a year's oncoplastic fellowship, I conceived, designed, and established South Asia's first freestanding, purpose-built, comprehensive breast center at Krishna Institute of Medical Sciences. Krishna Institute of Medical Sciences is as I mentioned to you, is a large corporate hospital, but the breast unit is entirely independent within the hospital campus. The entire assessment happens in one place, in a freestanding place, in a welcoming environment, where not just breast cancer, because it is not called a cancer center, it's called a breast center, where the vast majority of women with breast health issues present with benign problems, 9 out of 10 breast lumps are in fact benign. So the essential component of our breast unit is to be able to reassure the worried well. Worried because they think they have cancer, but indeed they have benign breast health issues, and they are reassured by a process of triple assessment and counseling. So we have a dedicated team of a breast surgeon. We deal with only breast diseases, no other subspecialty interest. We have a dedicated breast radiologist and a dedicated breast pathologist. We're very proud to say that Krishna Institute of Medical Sciences was the second unit in the country and the first unit outside of Tata Memorial Hospital, which established the first full field digital mammography system. We were the second unit in the country and the first in South India to establish a full field digital mammography system. And basically, this is a digital mammography ensures early detection of breast cancer. Particularly, it helps in detecting very subtle changes, particularly in young women with breast cancer. And with digital technology, the compression is less, the radiation is less, and the image can be sent anywhere across the world if there is any doubt. Certainly, the first high-profile visitor to visit our center after establishing the breast center within a month was the wife of the United States ambassador, who in fact had a mastectomy for breast cancer. She learned about the breast center and visited us, and she's really in touch with us, and we're very grateful to her and for her support. And she really came back on 2 other occasions, and she even spoke at a breast cancer awareness event that was held in Hyderabad soon after established in 2008. We had several high-profile celebrities who visited our breast center. You can see here on your screen Mrs. Shobha Day, who is a very well-known writer and author who visited our center. She is the patron of the Usha Lakshmi Breast Cancer Foundation now. We had the British High Commissioner who paid a visit to our center, and I'm very proud to say that ever since the breast center concept was established in Hyderabad, many centers across the country have now started developing breast centers. Some of the prominent centers include the Kokilaben Hospital in Mumbai, the HCG in Bangalore, and Medanta in Delhi. So KIMS Usha Lakshmi Center for Breast Diseases has really shown the way, and we're delighted to have introduced the concept of breast health in our country. The second paradigm change which is something very close to my heart, was to establish a breast cancer foundation, which has my mother's name associated with it, the Usha Lakshmi Breast Cancer Foundation. The reason for establishing the foundation is breast cancer is a closet issue. It is a topic that is hushed up, and that is one of the reasons why more than 60% of breast cancers in our country present in the advanced stage. And I knew that there was an urgent need to break free from this attitude. So the foundation, which has my mother's name attached to it, was established in 2007 to make a meaningful difference in terms of creating awareness and empowering people about the importance of early detection of breast cancer. And the slogan that we use is empowering women, impacting lives. So the three main aims of the foundation were to create awareness, to reach out to the community, and support breast cancer survivors. So the Pink Ribbon campaign, as is seen abroad, was launched in a very big way in 2007 by the foundation in association with KIMS Usha Lakshmi Center for Breast Diseases. We had celebrity breast cancer survivors come, perform, talk at events organized by the foundation and KIMS Usha Lakshmi Center for Breast Diseases. The first amongst them was Marcia Barrett, the lead singer of the legendary Boney M. And she had breast cancer, she survived it, she had spine metastasis. Despite that, she came and she performed live. And that was the first time that Hyderabad started taking notice of importance of early detection of breast cancer. We had many others like Gautami Tadimalla, who is a very well-known actor from South India, and her partner Kamal Hassan. Both of them came and participated in an event organized by the foundation. We started the Pink Ribbon Walks every year in October. We are in the month of October, International Breast Cancer Awareness Month. Since the last 8 years, we have been organizing Pink Ribbon Walks in the first weekend of October, starting off with just 500 people who started walking with us to empower people about the importance of early detection of breast cancer and also salute survivors and their families in the fight against breast cancer. It started off with 500 Hyderabadis, and as recent as 2015 October, we had more than 3,000 people from all walks of life, including breast cancer survivors, who participated in these Pink Ribbon Walks, which really have become a signature event in Hyderabad's annual calendar. The lady you see on your left is a lady who completed neoadjuvant chemotherapy, had surgery a day prior, and she came and participated in our walk. We had people from all walks of life. As I said to you, this is a gentleman on your left. You can see he's physically challenged. He has a disabled scooter, a scooter specially designed because he's a bilateral amputee. He put up a placard relating to breast cancer awareness, and he basically went around the Pink Ribbon Walk path of 2 kilometers. We have a lady here who's my patient who had a recent knee replacement. She came in a wheelchair to participate in the Pink Ribbon Walk. This is a 23-year-old breast cancer survivor, my patient again, who really fought with her family, and she came from the old city. She flagged off the walk. We had many celebrities, film stars, politicians come and support and endorse this event. And people from all walks of life, including from schools, colleges, participate in creating awareness. And you can see here, there's no place to stand, and the number of people who have attended this year's walk was well over 3,000 people. We had a foundation from Chennai who wanted to close the foundation because their trustees were getting old. They found out as to how we were spending our money through the foundation. They got an auditor to check our accounts. They felt that we were very honest and sincere in the way we spend our funds to create awareness, and they transferred their entire corpus into our foundation's account. And that is the credibility that we have achieved over the last 8 years. Now, this is basically another awareness campaign where we have a Padma Shri Award awardee, a very well-known dancer, Ananda Shankar Jayant, who actually demonstrated through a film made by Usha Lakshmi Breast Cancer Foundation, which was produced and directed by a well-known person called Mani Shankar. He's from Hyderabad. He has done many films. He's produced many films. He made this 1-minute film on creating awareness through the medium of classical dance. I hope we'll be able to play it for you. I don't think it is playing. Right. And then we launched the Paint the City Pink campaign in 2008 as well. Exactly, you can see here, these are prominent buildings overseas. The Buckingham Palace, Tower of London, White House, and you can see Charminar here. We have not illuminated just one monument, but several monuments were illuminated on one single night in the month of October. We've been doing this every year to demonstrate the power of pink. You can see the Buddha statue in the center of the lake in Hyderabad. This is the Prasad's IMAX. This is the United States Consulate in Hyderabad. And of course, our own institute, Krishna Institute of Medical Sciences, along with many other buildings, turn pink consistently year after year to demonstrate the power of pink and to raise curiosity among people as to why buildings are illuminated in pink, because pink color also represents breast cancer awareness. For the first time perhaps in the history of the country, Legislative Assembly, thanks to the former Speaker, Mr. Nadendra Manohar, we were able to illuminate the entire assembly in pink. This has never happened before, and such has been the support that we have been getting both from government and non-governmental organizations to support the Pink Ribbon campaign. This is our beloved Chief Minister, Honorable Chief Minister K. Chandrasekhar Rao, to whom I had presented the Legislative Assembly, which was illuminated in pink recently. We have started a newsletter to educate and empower gynecologists and in fact people from all walks of life. It's a quarterly newsletter which highlights on various issues relating to breast health. The lady you see on your left is my mother, Dr. Shalakshmi. The lady you see on the right is Ananda Shankar Jayant, who is also a trustee of our foundation and the convener of our breast cancer support group. We started a dedicated breast cancer support group for the first time in Telangana and Andhra Pradesh, and basically our aims are to provide psychological and emotional assistance to breast cancer survivors, I would call breast cancer conquerors, in fact, and their families in their fight against breast cancer through a number of initiatives that we undertake every month to support them. You have seen earlier about this film that we premiered in Hyderabad, One a Minute. It was a sensational news in 2010 when instead of this premiere happening in Bollywood, the Usha Lakshmi Breast Cancer Foundation was able to premiere this movie in Hyderabad, and instead of inviting just celebrities, we just invited breast cancer survivors and their families, and the theatre complex in Prasad's IMAX was absolutely full. The third paradigm change, something again very close to my heart, although the foundation was able to create awareness about early detection of breast cancer in city like Hyderabad through the innovative Pink Ribbon campaign, what works in urban India does not work in rural India. So if I was to implement a population-based breast cancer screening program, it would not be possible to use the same strategy. The strategy that was used in urban India, that is Hyderabad, was to create awareness through a number of initiatives and hopefully encourage people to get themselves a screening mammogram over the age of 40 annually, and we would call that an opportunistic screening mammogram. But in rural India, this would not be possible. And I'm always reminded of the fact, and like to highlight this, that nothing is more harmful than letting a breast cancer evolve from early breast cancer to advanced breast cancer. And as I said earlier, what applies to urban India cannot be replicated in rural parts of India. So the goals were to create awareness about importance of early detection of breast cancer in the rural parts of Telangana and Andhra Pradesh, and implement a population-based breast cancer screening program aimed particularly at the underprivileged community. Less than 5% of women in this country undergo screening mammography, and population-based screening mammography is not a viable option in India because of many reasons. Firstly, huge costs. Secondly, there's huge variation in mammographic reporting. We have very few qualified breast radiographers and breast radiologists who can report and who can determine what is an impalpable cancer, and subtle changes to be reported, one requires expertise, which is not really widely available in our country. And the important fact is, we are a young country. 13%, only 13% of women in our country are over the age of 50 years, where a screening mammography really works. The vast majority, that is 87% of our population, are under the age of 50, where screening mammography does not work very well. So, in an effort to find Indian solutions to Indian problems, we know that breast self-examination is not a useful screening tool, but there is considerable circumstantial evidence that clinical breast examination as a screening tool performed by a trained healthcare worker is the second best way to pick up early breast cancer. The advantages are that it is simple, it is an inexpensive tool. The screening method aims to downsize the tumor size, but the most important opportunity is to be able to empower these underprivileged people living in rural India about the importance of breast awareness and early detection of breast cancer. So in 2013, I had posed a question to the Department of Health in the then undivided government of Andhra Pradesh. The health department was headed by the health minister, the health secretary, and their staff. After making a presentation, I asked them, do you agree that the vast majority of women in the country succumb to breast cancer within a year of diagnosis? And if they said yes, which they did, is this not a major public health issue? To which they answered yes. And then I said that we have to do everything together, a foundation together with the government, to implement a program to create awareness and a screening program so that we can reach out to the vast majority of people. So here we are, we have the Chief Secretary of the Government of Andhra Pradesh, the Health Secretary, the District Collector, who launched this program, partnership between Usha Lakshmi Breast Cancer Foundation, KIMS Usha Lakshmi Center for Breast Diseases, and the Government of Andhra Pradesh, where we trained healthcare workers using audiovisual aids and booklets. These healthcare workers were trained to create breast awareness and perform clinical breast examination to women between 35 to 65 years. If the screening assessment was normal, then they would be returned in 2 years' time. If they were abnormal, the protocol was that they would be referred to the district health officials, and these district health officials would examine these women. If they think that the lump was suspicious, they would be referred to the nearest cancer center, and the entire treatment, if it turned out to be cancer, was provided free of cost through the Rajiv Arogyasri scheme. These are the healthcare workers by the foundation. This is the health minister in the government of Telangana who launched the program in Telangana, and this is the Chief Minister, Honorable Chief Minister of Andhra Pradesh, and we have basically the Health Minister of Andhra Pradesh along with the Union Minister for Parliamentary Affairs, Mr. Venkaiah Naidu, launching this program in Andhra Pradesh. This is a visual from the Secretariat from the government of Telangana, where through a video conferencing network, I was able to reach out to all the districts in Telangana from the GAD conference hall, where we were doing educating people through video and basically through PowerPoint slides. So this is on the ground where we have the healthcare workers who you can see here who are sitting in the center, educating women in the community health centers in the villages. You can see the video that we have developed, audiovisual aids which are being played to create awareness. So thus far, through about nearly 3,000 healthcare workers spread across 15 districts in Telangana and Andhra Pradesh, spread across nearly 3,900 villages, about 195,000 women have been educated about the importance of early detection of breast cancer and have been examined by these healthcare workers by way of clinical breast examination, a screening tool to pick up early cancers. We have picked up thus far about 207 breast cancers, and all of them are undergoing treatment or have undergone treatment through the Rajiv Arogyasri scheme. I have now moved forward. This year, I have formally met with the Honorable Health Minister of Andhra Pradesh, and also the Health Secretary of Telangana. And basically, we are working on developing a module where we would be able to train all the healthcare workers in both the states, covering the entire districts, all the districts of Telangana and Andhra Pradesh. The target is to reach primarily the underprivileged women in the rural background, aged between 35 to 65 years, and hopefully by 2020 we would have been able to screen all the underprivileged women for early signs of breast cancer, thus setting a benchmark for the entire country that breast cancer early detection can be achieved, need not be by screening mammography, but by the second best method, which is screening by way of clinical breast examination. So the traditional emphasis of population-based screening mammography has to move towards screening by way of clinical breast examination. I'm not saying that screening mammography doesn't work. Screening mammography is the best screening method that is available for women today. If they are 40 and over, they must have an annual screening mammogram. But the vast majority of the country cannot afford a screening mammogram, and majority of our women are under the age of 50 years. So therefore, in an effort to find Indian solutions to Indian problems, Usha Lakshmi Breast Cancer Foundation and KIMS Usha Lakshmi Center for Breast Diseases is now partnering in a very big way with the governments of Telangana and Andhra Pradesh to implement this screening program widely across both the states. So this is the Prasad's IMAX illuminated in pink. The final paradigm change is to establish breast surgery as a subspecialty in the country. Mirrored upon the American Society of Breast Surgeons, the Association of Breast Surgeons of United Kingdom, and Association of Breast Surgeons of Australia and New Zealand, the Association of Breast Surgeons of India was established in 2011 with the help and with the support of like-minded colleagues from across the country. This is an association that represents general surgeons, surgical oncologists, and plastic surgeons treating patients with breast disease, and the association is rapidly evolving as the most popular subspecialty association of the Association of Surgeons of India and represents the voice for breast surgery in this country. And in the fullness of time, we will endeavor to develop breast surgery as a distinct subspecialty in the country, and will also endeavor to standardize breast health care in India. This is the Ravindra Bharati in pink. Some of what I have spoken today has been published as an invited article in the Annals of the Royal College of Surgeons of England in the year 2011. Certainly a very singular highlight in my professional career since returning to India is to become the youngest ever recipient of the International Gold Medal that was conferred by the Royal College of Surgeons of Edinburgh in the 508 history of the college's history. I've had the great privilege to be invited this year by the American Society of Breast Surgeons, Association of Breast Surgery of United Kingdom, Sark Surgical Society, and very recently the World Congress of Controversies in Breast Cancer Management to highlight some of the innovative initiatives that have been implemented by Usha Lakshmi Breast Cancer Foundation and by the Breast Center at Krishna Institute of Medical Sciences. I am deeply grateful to the Government of India for having conferred the Padma Shri for this year. And in conclusion, what I'd like to say is that rising incidence and mortality of breast cancer coupled with the age shift and advanced stage at presentation is indeed a cause for great concern. Cancer must become a notifiable disease, and cancer registries across all the states must become more robust. There is certainly a need to find Indian solutions to Indian problems, creating awareness and implementation of a population-based breast cancer screening program must become a priority both for government and non-governmental organizations. We know that clinical breast examination is simple, is effective, and an inexpensive screening tool for India. If not anything else, it would definitely help to create awareness about early detection of breast cancer, particularly amongst the underprivileged community who do not have access to the pink ribbon campaigns that are done in cities. Certainly, there's a need for an urgent need for changes to be implemented across the country in an effort to improve the delivery of breast health care in our country. And I shall end by stating that no one can whistle a symphony. It takes an orchestra to play it. The Lord's grace, a clear vision, definite plans, focused action, personal discipline, reliance on the confidence to achieve, and unwavering support, particularly from where I'm standing today, the Krishna Sciences, led by its CEO, Dr. Bhaskar Rao, has given me unwavering support, because of which I've been able to implement many changes that I perceived were good, and I'm very, very grateful to him for giving me this opportunity. My heart certainly beats for early detection of breast cancer, and I trust yours too. Thank you very much.
We are getting a lot of questions from the audience. I have shared a few questions with you. Can you please take them?
I'm not able to see the questions.
You will be able to find the questions in the question window.
What are the issues and challenges faced by younger women who are diagnosed with breast cancer, I presume? Yeah. Now, as I mentioned earlier on in the presentation, compared to the West, where breast cancer is more common after the age of 50 years, in our country, breast cancer is more common a decade earlier, and the peak incidence is between 40 to 50. And we are seeing a lot of younger women too, women in their 30s too, being diagnosed in increasing numbers with breast cancer compared to the West. Now, when younger women are diagnosed with breast cancer, the issues are completely different to that of older women who are diagnosed with breast cancer. Particularly issues that may concern fertility, because when breast cancer presents, chemotherapy may be required. So basically, we have to involve the fertility specialist. There is a lot of supportive care that must be given, because the most important thing that I feel in our country, which is missing in most centers, is counseling. Counseling is 50% of the treatment. It's very important to sit down with the patient, write down the concerns that she has, and address them individually. So yes, the issues that are faced by younger people are very different to that of older people, and they must be addressed. And one of the things that helps very much is the breast cancer support group. ASHA is what we have established here as a wing of Ushalakshmi Breast Cancer Foundation, where we connect women of similar age groups with each other. So if somebody between 20 to 30 is diagnosed with breast cancer, we connect them together, because their issues are completely different from the older group. How many healthcare workers? As I mentioned to you, 3,000. Around 3,000 healthcare workers have been trained. That's just the tip of the iceberg. This is what we have been able to do in partnership with Telangana and Andhra Pradesh Mahila Samata Society, and also prior to that through the undivided Andhra Pradesh government, the healthcare workers we have trained. So now the partnership that we are inking with the governments of Telangana and Andhra Pradesh is to see that all the healthcare workers are trained, so that these healthcare workers, when they go into the community, they implement the population-based breast cancer screening program. The third question is breast cancer in rural, breast cancer be, it's not very clear. How can awareness be spread in rural? Yes, as I mentioned to you, what works in urban India doesn't work in rural India. In urban India, the Pink Ribbon campaign, using celebrities, using pink ribbon walks, illuminating monuments in pink, all that helps to create awareness about early detection. And I can proudly say that in Hyderabad, we've been able to create enormous awareness, and breast cancer is no longer a taboo. But in rural India, this will not work, and therefore we have strategized ourselves, and now we're channeling all our energies on training healthcare workers and implementing a population-based breast cancer screening program aimed particularly at underprivileged community, where they not only create awareness through the audio-visual aids that we have created, they also examine the women's breasts aged between 35 to 65 to be able to pick up cancer early. That has been our focus now, and that will be our focus in the coming or so, until we ensure that the entire states of Telangana are entirely screened for early detection of breast cancer. That will be our aim now in the next few years. How effective is the usage of tests such as BRCA1 and 2? I'm afraid I've written about this. I've spoken about it in media. I call this the Angelina Jolie effect. Although Angelina Jolie has done the right thing in getting herself a prophylactic mastectomy, that is a mastectomy before breast cancer sets in, it is not really common in our country. Basically, the breast cancer occurring because of genetic defects of BRCA1 and BRCA2 genes are rare. Less than 5%, around 5 out of 100 women have this abnormality. So the knee-jerk reaction to get genetic tests done just in case one has genetic abnormalities should be resisted, and only when there is a very, very strong family history of breast cancer, that is when 2 or more women in the immediate family have been diagnosed with breast cancer, or there is a history of breast cancer and ovarian cancer in the immediate family, or there is a family history of a male breast cancer in the immediate family, that is when there is a slightly increased risk of genetic abnormality in such people. So the first thing is counseling, proper genetic counseling, and only after counseling one must go for genetic testing, because the implications of getting a genetic test and the implications of the test being positive can be enormous, and therefore we must resist getting genetic tests done as part of routine healthcare checkup. As I said to you, the breast cancer incidence because of genetic abnormalities is not common. It is uncommon. So common things are common. As a country, we must develop strategies to educate people about early detection. We must develop strategies to detect breast cancer early by implementing a population-based breast cancer screening program. Our priority should not be to develop genomic predictive analysis or genetic tests as part of routine screening assessment. It is only very small segment of people who really require genetic testing. And we must weigh the options. We must stratify the high-risk group. These high-risk group women must first be counseled, and then only they must be subjected to genetic test. It would be unethical to do it in any way otherwise, other than the way I have just mentioned. Aside from the key factors you described in your talk, are there unique lifestyle or environmental factors in India that you think may be associated with breast cancer? For example, what do you think is associated with high rates of younger onset disease? Actually, to be very fair, as I said to you, the vast majority of our country is under the age of 50. That is, 87% of our population is under the age of 50. Now, is that the reason why we are seeing so many breast cancers being diagnosed under the age of 50? Probably yes, because if you see the Western world, a large proportion of their population is over the age of 50, and breast cancer is more common after the age of 50. When a population whose statistics show that a vast proportion of them are under the age of 50, then breast cancer probably is also a reflection of a stage migration, and that's probably the reason why we are seeing breast cancers in younger women rather than anything else. That's really what I feel is happening, although we don't have precise statistics to prove that point. Are there different types of breast cancer? Yes, there are two types of breast cancers, invasive ductal carcinoma and invasive lobular carcinomas. The invasive ductal carcinomas are those cancers that occur within the ducts or arise from the ducts, and invasive lobular carcinomas are those that arise from the lobules within the ducts. The vast majority of cancers are invasive ductal carcinomas. Are you planning such partnerships in Karnataka? We want to start small. In fact, I have already written to the Honorable Prime Minister of India relating to implementing this population-based breast cancer screening program as part of the National Cancer Control Program. I have also received a reply from the Prime Minister's office and a directive for me to meet with the Union Health Secretary. I have also done that and met with the Union Health Secretary, and I have explained to him the model that is being implemented in Telangana and Andhra Pradesh, and that, you know, Usha Lakshmi Breast Cancer Foundation would be very happy to guide similar projects in other states. So if somebody wants to implement this in Karnataka, we'd be very happy. And in fact, I can share this with you that the Association of Breast Surgeons of India, for which I am the president, one of our aims during my presidential term, what I have already outlined, is that we would like to partner with governments, state governments outside of Telangana and Andhra Pradesh as an association, and the Usha Lakshmi Breast Cancer Foundation. We can partner with the, say, government of Karnataka and start implementing it there. The Honorary Secretary of the Association of Breast Surgeons of India, Dr. Somshekhar, is from Bangalore. I've already discussed with him about the possibility of meeting with the Health Minister and the Health Secretary there to start this program there. And we are working on it, and hopefully within a year we should have some answers. I think I've answered most of the questions. Incidence of triple negative, 12 to 24% of cancers in our country are triple negative cancers. Triple negative cancers do not carry good prognosis. And yes, we do see a significant proportion of women, particularly younger women, who are triple negative. What specific types of treatment and associated side effects are of greatest concern for younger women who survive breast cancer? I think the greatest side effect, the most significant side effect that any young woman would dread is losing her hair. I think it's very important to counsel such women about loss of hair, because it is a factor that affects her image. The second most important thing that affects a young woman diagnosed with breast cancer is fertility, and fertility preservation must be done, and fertility expert consults must be a priority for all younger women who are diagnosed with breast cancer, and no treatment related in her 20s, 30s who are unmarried or just recently married should never proceed without a fertility consult, because chemotherapy has an effect on fertility, and fertility preservation techniques have evolved over the years, and it's very important to consider fertility preservation in these women. So these are the two main issues, I think, in addition to the fact that a young woman has probably a young family, she must have just recently got married, she may have young children, so the issues that concern her are enormous and considerably different to those that are seen by women who are older. What are your thoughts about regular sonography for women under the age of 40? No, there is no evidence for screening imaging under the age of 40. The guidelines, there's a lot of controversy relating to screening, but women certainly in our country, when we are seeing so many breast cancers, the vast majority of breast cancers between the ages of 40 and 50, I think it makes sense for all women 40 and over to have an annual screening mammogram, and that is a must for those who can afford. This is a season of festival. We recently had Dashara, we now have Diwali. I think the men in the family, instead of buying a sari or instead of buying yourself a sari, I think if you gift yourself or a gift your loved one a screening mammogram, that would be the best gift during this International Breast Cancer Awareness Month. Screening under the age of 40 is not effective. Screening by way of just ultrasound scan is not proven to be effective. I think I've answered all the questions that have been posed.
I think we can take this last question.
Yeah. Aside from the key factors described in your talk, are there unique lifestyle or environmental factors in India that you think may be associated with breast cancer? For example, what do you think is associated with the higher rates of younger onset disease? As we have gone through this earlier as well, we don't know what causes breast cancer at this age, but I think, and I think this is what the scientific community in the country thinks, as our country is a young nation where the vast majority of women and men indeed are under the age of 50, it's probably that is the reason why we are seeing so many breast cancers at a young age. Now, is it because of environmental factors, the water we drink, the air we breathe, whether food we eat? Yes, surely there are carcinogens everywhere, and whether they are contributing or not, it's very hard to say. But as to why breast cancer is occurring a decade earlier in this country compared to the West, the answer lies in the fact that our age group, our population statistics, which show that the vast majority are under the age of 50, and that's why we're seeing the large proportion of breast cancers being diagnosed at an early age. Anything else? Okay. Thanks very much for giving me this opportunity. On behalf of Krishna Institute of Medical Sciences, we really thank you for joining, and I am very grateful to Economic Times ET Health for giving me this opportunity to deliver this presentation.
Thank you, Dr. Raghuram, for presenting this insightful webinar. I would also like to thank all the attendees who joined this webinar this afternoon. The recording of this webinar will be made available on ethealthworld.com by tomorrow. I thank you, everyone.